Merhabalar. Bugün size bir sürprizim var. Bugünkü homeopat konuğum yurt dışından ve röportaj da İngilizce gerçekleşecek. Bunu niye yapıyorum? Biliyorsunuz ülkemizde homeopat sayısı artık hasta taleplerini karşılamaya yetmiyor ve randevu süreleri çok uzamaya başladı. Ben de şöyle bir çözüm buldum bu konu için. Artık size yabancı homeopatları da tanıtacağım. En azından yabancı dil bilen anneler eğer dilerlerse bu yabancı homeopatlarla temasa geçebilsinler diye. Dolayısıyla bu Türkçe açılıştan sonra konuşma İngilizce devam edecek ve arkasından Türkçe çeviri olmayacak. Çünkü bu dediğim gibi dil bilen Türk kullanıcılar için bu röportajın amacı bu şekilde belirledim. Bugünkü konuğum Dr. Rukshin Master from Singapore. Hello Rukshin, how are you?
Hi, Sadar. I'm good. How are you?
I am usually happy and fine, but of course, over the long time of this disease restrictions, I confess that I am bored and I put some belly fat. I put on some belly fat.
I think all of us have done that. But it's a good time actually for a lot of us to develop a lot of new skills. There's a lot of learning around. So it's been good with that you got a little bit of a break to update yourself with a lot of knowledge. But yes, of course, we miss family. We miss being connected with them and friends, of course.
So I usually start with my interviews with, of course, knowing the doctor I invite. So can you please mention yourself a bit for us?
Sure. So for me, actually, homeopathy was something that started literally from the time that I was born. With my father being a homeopathic practitioner, I have always been raised completely on homeopathic medicines. Even as a child, I had many infectious diseases, including mumps. I've had measles. I've had all different kinds of infections and allergies. But through everything, we kind of made it certain that I would be on as minimal drugs as possible and as much on homeopathic medicines. Only because my father also believed in the same principle that the starting years of a child's life is when their immune system actually develops and builds. The more you let it build correctly, the more stronger it will be in the future to fight against various diseases that you may have. The minute in the beginning years of your life you hamper with the immune system, that child does not grow up to be a very strong adult. And so that's why I've always been raised with homeopathy. Coming into my teenage years, it seemed like a very obvious direction for me to follow the footsteps of my father. And so I started with my homeopathic education back in Bombay in India. It was a 6-year program for us in India to become a homeopath because we're called homeopathic doctors. So we learn everything about internal medicine as well as homeopathic remedies. And then after those 6 years, I did my master's, which I did in pediatrics, so which was another 3-year program. And then once I finished that, I ventured upon my PhD. And I've recently just finished my defense of my PhD thesis. And so I should be very soon be getting my degree. And my PhD I did in the topic of autism, which is also in pediatric children, where we did a clinical study in a research hospital back in Bombay to show the effects of homeopathy in autistic children. So this has been my journey so far. Of course, through the path, I've done a lot of teachings, a lot of workshops that I've attended, a lot of hosting different events because of my father, of course, organized a lot of homeopathic events, seminars, teachings. And 2 years back, my husband's work brought us to Singapore. And so since we've moved to Singapore now, and this is where I practice, I've since then opened up my company here. I have my organization where I'm working at 3 different clinics, of course, only prescribing homeopathic medicines. And along with that, I side by side teach at a lot of international level colleges. Side by side, we have an organization of homeopaths out here where I regularly host programs. So I think, as you can guess, homeopathy is something that I live and breathe. Everything that I do is somewhere related to that. And now, having being a mother of a small child, a 3-year-old, I now understand what it is to be a mother and to raise a child again with homeopathy. With her also, I have tried to protect her from all different kinds of treatments, just to put her only on homeopathic medicines as much as possible.
You make a very nice entry to my questions in my mind by sharing your personal experience in childhood. So I want to start with this question. How much a mother should take care of a natural disease? Like a true disease like mumps, measles, whatever. How much a mother really afraid of that natural disease? How should we protect our kids from a natural disease? Which methods we should choose to protect our kid? And then what we will do if the kid gets the disease anyway? So I give all the time to you. I make one long question and you give one long answer, no problem.
Sure. Okay. So that's a really nice question. And in fact, I feel like this is something which all mothers should know. With handling childhood diseases, knowledge is power. As much as knowledge a mother has, that is what is going to help her either be relaxed and make wiser decisions, or get into a panic mode and make decisions which she might later regret. So, what I like to do is when a mother comes to me first, I like to educate them about everything. So, even let's say a child comes to me with a complaint of eczema, which is not related to infectious diseases and fevers and cold coughs, I will still educate the mother that, what, should such and such a thing happen, what are you supposed to do? What should be your first call? What are you supposed to start with? And most likely, my first advice would be to communicate, of course, very closely with me as a homeopath, and for me to then advise based on the symptoms. But also, the mother should know what is normal and what is not normal. So, for example, when you brought up infectious conditions, which are most likely with fevers, the most common ones being your chicken pox, measles, mumps, all of this is something the kids catch in school, and the minute one child gets it, all the children have the same condition. Even hand, foot, and mouth disease is very common in a lot of infant and preschools. So, what I like to advise them is that you have to be in touch with somebody who can guide you better. Don't immediately rush to the emergency. Don't immediately start antibiotics. Don't immediately start off with medicines which bring down the fever. First, understand what is happening. If it is a regular viral cold, cough, the child is having a little sneezing, watery nose, the first step of action, which I normally advise, would be one, to start off with home remedies, simple basic things, steaming, warm water with a little turmeric, with some ginger, or then contact your homeopath. And in most cases, I will give a very basic acute prescription to start the child, whether it be arsenic album, whether it be pulsatilla, based on the symptoms that the mother gives me. Then, of course, when there is fever involved, again, I like to educate the mother and explain to them why the fever is happening. Now, fever could be because of hundreds of different reasons. Most likely in the pediatric age group, what we see on a day-to-day basis when we see a fever, cold, cough, or a fever with diarrhea, or fever with constipation, it most likely is a viral fever. Now, these viral fevers again stay for 4 to 7 days, but after that, you will eventually notice that the fever will taper off on its own, even if you do not use any medicine to lower the fever. But what the mother needs to know is, why is the fever coming? So what I like to explain to them is that the body is raising its temperature, because at that particular temperature, the infection dies on its own. It cannot survive in those heaty temperatures. And that is the internal protective mechanism of the body to help fight this infection. The minute we are giving a medicine that removes the fever from the body, there's no more fever, so the body is left handicapped to fight the infection. Now it has to fight even harder and even stronger and use more resources to fight that same infection had you just let that fever remain for some time. Of course, in homeopathy, I like to also give them medicine side by side to help control all the other symptoms, to see that the child does not become weak, should not become dehydrated, should maintain their appetite, sleep should be okay. If there are any other symptoms like cold, cough, diarrhea, it should control that as well. But knowledge, as I said, is important. So if a mother feels safe after that, she's never scared. The mothers who I see normally in my practice, now the fever is even 102 degrees Fahrenheit, 103 degrees. If they understand what is happening, what to expect, what the medicine will do, they are never scared and they will always stay in touch with me. They will not give a medicine to just suppress the fever. But of course, if a mother does not have that knowledge and if she's not been trained and, maybe one or two instances the homeopath and the mother deal with through one or two fevers, then the mother is also more confident because now she knows that, homeopathy can take care of even acute infections very well. So I feel that's the key. Mothers should know what they are doing, know what is happening. Of course, I don't expect them to be doctors, but just a little basic knowledge of, understanding your child.
At some point, I want to ask this question. I don't know about other mothers, but Turkish mothers are, I don't think they have the patience to wait 4 or 7 days for a fever to go down. So, but you use the word vital fever. I noticed that. So, is there a fever that we should take care of versus vital fever? And then how can a mother discriminate between the dangerous one and the friendly one? And what can you tell for a mother to recognize the difference and which one is the friendly fever and which one is not, and what to do? Like, can you be more specific on that?
Sure. So when I say viral fevers, I mean fevers caused by any viral infections. Now in viral fevers, normally, I mean, this is not the case.
Vital. Why viral?
Not viral.
Oh, okay. We
make
the correction.
Viral. Yes. So viral fevers are more common in children than bacterial fevers. And viral fevers are the ones that normally tend to take the temperature a little higher. With bacterial fevers, normally we would see the fever being a low grade fever, so to say. So the temperature, if you see in Fahrenheit, would be about 99, 100. But whereas in viral, you see the fever going to 102, 103 also. So what we normally advise the patient is that a higher fever does not mean it's more infection, and a lower fever does not mean it's a lesser infection. Sometimes the most horrible pathogens, for example, if you see tuberculosis, which we know is a very deadly disease and it kills also, the fever with that is always a low grade fever. So it'll be a 99, 100 fever. But a viral fever, which is even a 104 fever, will last for 4 days.
Can you use centigrade instead of Fahrenheit?
Sure. Okay. So centigrade. Okay. So let's say with a tuberculosis, you will see a fever of about 38, 38.5. Whereas in viral, you will see a fever of 40 degrees also. But that viral fever will stay for 40 degrees, go away in 4 to 7 days. The tuberculosis fever, which was a 37 or 37.5 fever, will stay for months and months together till you take the actual courses for maybe 3, 6, 9 or 12 months of antibiotics. So don't assume that a higher fever is a worse fever. That is not true. That is something mothers get scared of. If the fever is low, they are not panicking. But the minute the fever gets high, they panic. So they need to be taught that high fever is not a bad fever. And sometimes as quickly as the fever goes up, it comes down equally quickly. And with homeopathy also, some medicines, like sometimes I have used bryonia with high fevers. And within giving the medicine, within 30 minutes, the fever comes back to normal. So homeopathic medicines are also, if you give them, accurately based on the symptoms, they are capable of helping the patients in acutes very, very quickly. Now, as far as coming to differentiate between the different kinds of fevers, you have to go to a medical professional. It is not easy to do that at home. It requires also physical examination. The doctor has to check the throat, see where the infection is, first understand what is causing the fever. And then based on that, we can really determine. So in my medical opinion, I will not advise someone at home to diagnose a fever and take a chance. But at the same time, don't rush to your doctor on day one. You can always wait for 3 or 4 days to see the symptoms and see how they are manifesting, and then go to a doctor. And that at that point of time, the doctor can run investigations also which can then help you diagnose the infection. On day one, it's impossible for anyone to come to a diagnosis.
Thank you very much. I listen many lectures on fever, and every time I am learning something new. So for myself and mothers to be very clear on that, I just make a summary of my understanding. A high fever not necessarily is bad, and low fever is not necessarily better.
Exactly.
Well, virus infections tend to make a higher temperature fever, and bacterial infections tend to make a lower temperature fever. And then which one we should scare more, viral infections or bacterial infections? Which diseases are more terrible?
These are just generalized, rules that I'm saying. Not every viral fever will be only a high fever, and not every bacterial will be a low fever. Generally, as the first thought that should come to a physician's mind when treating fever, when it is a little higher, we would think more of a viral fever. When it is a little lower, I would think more of a bacterial fever. But of course, there are tests which you need to do to really determine that. Not one is worse than the other. What makes it worse is your vitality. If your immune system and your vital force is poor, every fever is a bad fever. If it is good and strong, and if you have let it build up, then every fever will be a good fever where you can come to terms with it much faster.
Aha. So this is a very important, clear discrimination criteria. So I want to underline it. So if we raise a kid that is already a strong one, then a high fever on that kid shouldn't be very scary. But if the kid is already struggling with some chronic diseases, then any disease with fever will make the kid tired too much, and then perhaps we shouldn't let it alone to clear itself. That is exactly the time when we need the doctor's help. Is that right?
Correct. So I would just like to add in a little something to this as well. Yes, so you are correct. When a child's immune system is good, the child will be able to deal with it much better. So the cells which are produced with every kind of fever are these antibodies. So we develop antibodies to the virus or antibodies to the bacteria, and that process works much faster because the body's immune system is performing well. Now, when you spoke about the chronic condition, there are two things to remember for this. One is that in a chronic disease, when a person has a fever, you are correct. You should leave it alone, in the sense that you should definitely not suppress it with any antibiotics or with any paracetamols at that time, because it is a body's expression of trying to bounce back. So I have noticed this many times, that every time a person is in a very low health status, and the minute you start homeopathy and the person is recovering, the body will throw out an acute condition. So most likely we see a fever coming on. Now when that fever comes on, it is the body's chance to be able to work and build up on those antibodies, fight some pre-existing, infection which might have been lying dormant in the body for all these years. And now it's coming up because the body feels like it is strong enough to fight it. So the body is trying to fight it. At that point of time, when you suppress it, the body again goes back to a worse chronic state. So definitely in those conditions, try to avoid suppressing a fever as much as possible and treat it homeopathically. And secondly, when it comes to treating fevers in a chronic condition, one should always remember to be a little more careful, only if the body's immune system is not too good. And the biggest risk you run with a fever is dehydration. So as long as the child is hydrated well, most of the times with simple fevers, they will always pass by much easier. The symptoms will be lesser, the temperature will be lesser, the body will recover that much faster. So hydration is the key for fever, so to say.
Okay, before closing this subject, I am still amazed that even in my own training, there is gaps, and I am discovering it through your speech. So, a healthy person get infected, develop fever. We shouldn't be very scared of it. Okay. And we should never suppress it with chemical drugs. Absolutely no question on that too. But you just said, like, for example, I give Byronia and the fever goes down in half an hour. Now, what happens when we give the homeopathic drug to this sick person? That the fever goes down very quickly, but that is something we want, and that is not we call suppression or that. Like, I mean, for half an hour you talk about never suppress the fever. Fever is friend,
Sure.
and then you said, but we give Byronia and the fever goes down in 30 minutes. Why we do that? Like, what is the difference? You know?
So I'll explain that to you. Actually, I get this asked quite a bit. So I know exactly, how it is when people feel that way. What happens when a child has fever and you give a paracetamol? That paracetamol, do you all have paracetamol in Turkey, or what do you
Yes.
call it?
Yes.
Yes,
Yes.
paracetamol. Yes. So when you give paracetamol to children in with the fever, what happens is it's only addressing the temperature. There are many studies which have been done and research which has been done on this to see that paracetamol has no effect on the immune system to help the body produce these antibodies to fight the fever. You understand? So it's only reducing the temperature. It's not working on the overall system. Whereas when I'm giving my bryonia to that child for the fever, my bryonia is not only acting on the temperature. Because when I give bryonia, the mother will say, oh, the appetite also became better. Oh, the thirst is also better. The child is more active. Child is playing more. The fever, in most cases, will not stay low for 6 hours and then come back, like how it is with paracetamol. The fever will then eventually automatically get taken care of along with the immune system being supported with bryonia. So that is the main difference, that we're not only targeting the temperature with our homeopathic remedies.
One targets, the paracetamol targets only the fever. It's like putting the child into refrigerator, almost,
Correct.
in model. But bryonia decrease the temperature because the child actually beats the disease.
Exactly.
Okay.
So very rarely will you hear of a mother tell you with a fever when you give a prescription that, after 4 hours the fever comes back. Then when I give the medicine, the fever goes and then it again comes back, like how it happens normally with paracetamol. Normally with homeopathy, when you give for fever, you will always see, okay, the temperature was 40 degrees. Now it's become 39 degrees. After a few hours, it's become 38 degrees. And then eventually, gradually, you see that the decline of the temperature is together with the overall improvement of the child. So it both has to go side by side. You can't only target one if you are giving the correct homeopathic remedy.
Of course, naturally.
That's important.
That's always the case. I mean, if you do the wrong treatment, it's even worse than not doing any treatment.
Exactly.
Okay, now I want to stay in this area, but not in the fever area anymore. Now, we are trying to raise a healthy children. And before we know homeopathy, before we know any doctor, from the grandmothers, we know that a child will be healthier if the child gets the disease naturally and defeats naturally. In fact, I remember, I am not that young, so I remember. Also, my grandmother is still alive. That's also how I know too. When the kid was sick, they put the brother or sister into the same bed so that he or she could get the disease naturally and get done with it. And that was before reaching a good doctor or not knowing about homeopathy at all. Like it was so natural process of raising a healthy kid. Now we come to this moment of our life, the new era. We know homeopathy. We have all the hospitals in our city, but our goal is still raising a healthy children. Now, okay, I have a homeopathic first aid kit. I have a phone number of my homeopath, and a backup is my neighborhood hospital, big hospital, okay. But should my kid get the disease, or I should do everything to prevent for the kid not to get any disease?
Okay. I understood your question. Okay. So for this, I like to normally explain to my mothers with a very simple example, saying that when your child is very protected. So right now is the era of hand sanitizers. You see hand sanitizers being used everywhere, including I have seen mothers who use it every 15 minutes on their children when they are outside in the playground, because they're very scared of infections. And I feel like this is something which really needs to be spoken about and addressed, because infections is not a bad thing. Bacteria is not a bad thing. Virus is also not a bad thing. We are built up of that. More than 70% of our body right now is made up of bacteria and viruses. All bacteria are not bad and all viruses are not bad. They are also equally essential. In fact, every single cell of our body in a certain way is supported by these bacteria and viruses. A lot of our bodily functions is supported by them, and without them we are nothing. A human body cannot exist without them. So they are all equally important, and we have to integrate ourselves to work harmoniously together. The minute the bacteria and the virus in our body is not harmonious and is actually causing harm. So there was a study which was done which said that when your body's immune system is not optimal, the good bacteria inside you become bad bacteria. And that's again why your immunity is so important, because when your immune system is good, everything works harmoniously and synchronicity inside the body. Now, the minute that does not happen, that is when you catch infection. So sometimes mothers can use all the sanitizer that they want, but if the body's immune system is not good, the child can catch infection from everywhere. And it is impossible to keep your child in a bubble throughout their life, where you surround them with a bubble wrap paper, and where they breathe in only what you want and they touch only what you want. That does not happen. You have to expose them to dirt. You have to expose them to other infections. Otherwise, the body will not grow. So, for example, in childhood, if you do not catch the basic infections, just your regular cold and coughs, your regular viral fevers, if your body does not produce antibodies to those, it does not know how to fight the bigger things. So then later on in adult life, when you are exposed to other chronic conditions or other infections, your body will be clueless on how to exactly fight that, because every time that this body has had a fever or a cold cough, the mother has given something to suppress that. So the body could not start the process of fighting that infection. And that's why it's so important to get those infections. So, like you mentioned, there used to be measles parties. Even back in Germany, I have heard in the day there used to be measles parties, where the minute one child gets, all the neighborhood mothers would get the children to that house, and everybody would get measles. Why? Because that immunity was lifelong immunity which the child had. And there have been many studies which have shown that certain childhood infections not only provide you immunity from that particular infection, but from a lot of other diseases in the future, including a lot of chronic diseases in the future, reduce your risk of cancer to certain conditions. So the benefits are immense. Of course, they did have certain complications. Every fever, every condition can have those certain few children who did not do well and maybe developed complications from that fever. But there could be a lot of reasons to that. So that's the reason why I always advise that if you're not medically trained, don't do it all by yourself. Just do it in conjunction with someone who knows what they are doing, and then it's much easier to help and work with these infections.
So I want to move to protection side. Now, but I like very much the word you use, harm and harmonious. I want to make one example that it reminded to me. An orchestra. A musical orchestra consists of many musical instrument musicians, and can create a good symphony or noise based on how the chef managed the orchestra. So a noise is the disease and the symphony is the health. But the many instruments and musicians are there all the time. we don't say we don't say drummers go away because you are bad, or we don't say flutes go away, you are bad. Everybody is there all the time. But to create the good music or the noise is only a matter of managing it. And the word you choose, the harmonious, describe it like very, very well. I really appreciate it. Now I want to move to a protection side. Now that you said don't afraid fevers that much high, I mean, don't afraid the fevers too much as you do today, and then don't afraid the disease that much as you do today. But then we have two way of protection that we know. One is very well known and the other one is less known but still available. So should we protect a child in certain situations? I'm not talking about a hygiene or something. I'm talking about a serious protection. You probably realize where I am going to from here. One is medical produced vaccines, and the other one is homeoprophylaxis. Should we induce our children to vaccines or using homeopathic remedies with disease nosodes in advance to protect, or we should intervene childhood only after the child gets sick?
Okay. So I feel with children, building a sound and a good immune system is of the first priority for any mother. So as soon as a child is born, what happens is that, especially at least in India, the day the child is born, the first dose of the vaccination is given. After that, then the first month, and then every few months there are doses which go into the child's body. My opinion on the entire situation is that while I would have preferred that we were not living in a world where it was mandatory. I don't know about Turkey, what is compulsory for you, but in Singapore, we have a lot of vaccinations, not as much as the US, but still a few vaccinations which are mandatory for every child to get. The way around it for a mother, first of all, if you ask me if a mother should do it or shouldn't do it, I would say that it depends on the law of your country and how you wish to adhere to the law. If you have to do it, I don't see a way around it. What you can do is help your child before and after. That is very, very possible using homeopathy. So for example, even right now in Singapore with the COVID vaccine, I have a lot of people who tell me, can you help us to build up our immune system so we don't get the side effects of the vaccine, so we can detox the vaccine. For all of that, yes, homeopathy can help as a supportive structure before and after. As far as homeoprophylaxis is concerned, I know that there are a lot of practitioners who do that. There is a whole schedule of vaccinated remedies which are then given to the children in substitution for the dose that they were supposed to receive for the vaccine. Now, while I don't personally use homeoprophylaxis with my patients, I know that people who use them have had very good results and have been very successful in preventing the conditions based on the protocol that they are using to do it. With me, when a mother comes to me with a child and says, I don't want to vaccinate, can you help me? In that case, I keep the child on homeopathic constitutional treatment because I feel like that itself will help the immune system fight against any infection and, make them stronger. Of course, when they have to get a certain, so with Singapore, as I said, few vaccines are compulsory. So when mothers get those vaccines, for the other vaccines, if they choose to not give it, then I can procure the homeoprophylaxis remedies and then I keep them on a schedule with that. But the thing is, vaccines have become very, very controversial. The minute you try to say something against it, you become an anti-vaxxer. And people think you don't care about the community's health, you don't care about your own health, your child's health. We were also raised in a way that we were taught that vaccines do contain certain elements, so to say heavy metals, a lot of aluminum, a lot of mercury, thimerosal, a lot of other things which go inside, formaldehyde, which is not very good for your body. So what I would prefer to say is that let's help detox them rather than try to go against the authorities and be controversial in any way. So we do our own protective and supportive mechanism with that.
Again, this suddenly become like advanced class of homeopathy instead of teaching mothers, but I'm very happy that we are going this direction. There has a debate in Turkey too about it. So since you mentioned, I am happy to ask about this. Now, in my opinion, in our repertory, Materia Medica, about effects after vaccine rubrics, etc., when they talk about tuya, silica, etc., that was like 50 years ago, 100 years ago. Those vaccines are not the same vaccines that we are getting today. So my idea is like, how can you get vaccine clearance support from a remedy that has chosen 100 years ago with the clinical experience created with totally different vaccines? Like, you have to take new symptoms and maybe use new remedies. This is my idea. But controversially to this, I have difficulty to persuade people that they truly believe that using some cell salts or tuya, silica will clear all the bad effects of modern vaccines. What can you say about it? Like, when you say I am helping to the people who get the compulsory vaccines, what do you actually do?
Okay. So the people who are on my homeopathic treatment, I support them much better with the constitutional medicine. I would say that should be your first go-to. Secondly, of course, thuja and silesia and all of those remedies are used. There are a lot of other ones also. For example, there are some parts of the Materia Medica which talk about specific remedies for specific types of vaccines. For example, after the MMR, they say variolinum, for example, those kind of remedies. We also have remedies called vaccinum, which is generally made from the vaccine. Then now, if you actually look, there are certain pharmacies in the UK which make remedies from the brand of the vaccine being used in your own country. For example, with HPV, there are different kinds of HPVs being used in different countries. So they have different brands of the remedies also. So if someone wants to use isopathy, for example, to treat the effects of the vaccine, then that option is available too. I will say that I did try it on a few patients. It did not give me the satisfactory results that I would have liked. For example, I had a child injured with the HPV vaccine. She must be about 14. She developed POTS, which is postural orthopnea, and she had a lot of symptoms with that. I tried the HPV remedies on her. It did not give me a very satisfying result, which I feel like I see well with my constitutional remedies in other patients.
So the main defense is not some vaccination after rubric remedies, but supporting the person with their constitutional remedy.
Correct.
That in your clinical experience, that proves a better results.
That does prove a better result rather than going specific. However, what I also like to do is, if I feel like I want to support them with both, I use the constitutional remedies around the time of the vaccine, but just a few days before and after, or on the day of the vaccine, I will use a specific remedy. You understand?
Specific
so
remedy?
let's say for the side effects of the vaccine. So whether it be a Thuya 30 or if I want to give a vaccine in 30, I will use it just 1-2 days before and 1-2 days after the vaccine. But before and after those 2-3 days, they will still be on their constitutional remedy.
Okay, so there are almost 40 different vaccines. How do you choose to give Tuya or Vaccinum or whatever other you are using? For which cases you use which remedies and you decide how?
So as I said, there are certain books that I refer to for this. There are certain remedies, like for example, we have BCG 30, we have polio 30. Those kind of remedies are also available with us. So sometimes if it is the kind of vaccination that they are getting, then I would use more of those specific remedies rather than use but if it's something which I don't have with me, then I would go for the generic ones like Thuya 30 or a Silica 30.
Okay.
Yes.
That was like a lot of information to digest, so I need to take a breath and
Yes,
where to go from here. So we talk about the fevers and we talk about the natural diseases, and then we talk about our defense, whether we should get it or protect it. And then when we have it, and then when we don't want to have it. Okay, I think on this topic, this final blow is this. Eventually, do we want this disease or like we should avoid it? Like, I mean, partially you answered this. Like you said, if it is a law in your country, all I can do is to help to go along with the law. But imagine I live in like a countryside, not governed very well. Imagine my only concern is only my health. So should I get the natural disease or should I protect myself using vaccine or homoprophylaxis or hygiene, whatever? Like the final blow is, should I get the disease or should I protect myself?
Okay. So I won't answer this directly, but I will answer it indirectly.
Okay.
When a mother chooses to allow her child to get that infection naturally, as I said, there are two advantages. One advantage is the body produces the antibodies, so there is lifelong immunity and protection generally from that infection. And number two, as I said, when the child gets that infection, they are protected lifelong from a lot of other conditions as well. When a mother chooses to artificially produce that immunity with the help of anything, what happens is that most likely the immunity is there for a few years, depending on the type of vaccine that you get. Then it needs to be repeated. What a lot of mothers don't know is that most likely every 10 to 15 years, a lot of shots need to be repeated to be able to provide that immunity. It is not a lifelong immunity. Secondly, in spite of taking the vaccination also, there have been reports where children get those infections.
So there is no guarantee that if I do the protection, I will be 100% protected.
No, yes. So it is not a guarantee for sure. The child can still get the infection. The infection can in some cases be mild, in some cases be severe. So that is a risk that the mother has to take when they do that. And of course, we all know that there are documented and reported side effects of the vaccines, which have been reported, which if you go to your doctor and just see the cover of the vaccine that they are giving you, they will list them down as the list of side effects. Of course, they don't occur in all of the children, but they do occur in a few. They do tend to occur more in children who have a poor immune system. They do tend to occur more in children who have allergies. So if your child has asthma, has eczema, be very, very careful, because that child is going to be more vulnerable to either having the diseases which already exist become much worse after the vaccine, or getting some side effect from it. So all of this, what I'm saying, is all documented, it's all researched, the information is out there on all the big medical websites. So it's important to do your research when you are doing it.
Mhm.
And yeah, so I think that should answer your question.
Yes, I think like this was a very big file for covering all the aspects of childhood diseases, fever, vaccination, homeoprophylaxis, vaccine detoxing, the tools we have, the nozzles, isopathy, everything. This was really good. Thank you very much.
No, my pleasure. Would you like me to talk to mothers about homeopathy and how they can use it for their children? So I think that this is very, very important for every mother to know a little bit of the basics of homeopathy to be able to help their children. Because with children, what happens is that every week is something new. One week there is a cold, the next week they fall down, the third week there's vomiting. And for simple things, if they themselves know how to treat at home, it saves them that visit to the doctor, it saves them that trip to wait in the emergency. So, a little basics is what I would expect all mothers to know. And I feel like the minute a mother starts working with a homeopath, automatically they start learning about homeopathy. So, half of the mothers that I see for their children already know all the homeopathic remedy names. They know what to start the child on if they cannot get in touch with me. Because after a few months, it becomes very natural and it's very easy to learn what to use for your children. Uh, that being said, of course, I would not suggest mothers who don't know anything about homeopathy to do it. They should work with a homeopath on the side, or at least keep them updated, just so that medically, the child should be well taken care of. When it comes to simple things, and if you have the kit with you, that is the most important thing. So, one thing I urge all the mothers to do is keep homeopathic remedies with you. Otherwise, in emergencies, it becomes very difficult to use homeopathy. In Singapore, we don't have any homeopathic pharmacy, but even in Bombay, in a city which has lots of homeopathy, we never for the longest time had a 24-hour pharmacy. So, in the night, mothers don't know where to run to get the medicine. They don't understand what to use. So I feel like having a kit with you is the primary thing. So definitely have the basic remedies with you at home. When it comes to emergencies, maybe I'll discuss a few basic tips which you can use for different kinds of conditions. Of course, as everyone knows, with homeopathy, it's very symptom specific. But this could be your first line of medicines, and then after you speak to your homeopath, you could always do something else. So I'll share from my practical experience what I'll end up using. Uh, for injuries, let's start with that because that's something very commonly seen with children. Bruises, redness, there's swelling, there's inflammation. The first thing which you should think of is arnica, especially after any injury. The potencies for all the remedies will vary. On an average, I like to stick to the 200C potency for children, especially when the disease is very acute, it has come on very suddenly, and there is a certain intensity that I see. Of course, if there's more intensity, I do 1M, and if there's less intensity, a 30C. But on an average, I could start with a 200C. Also, one thing to remember with repetition when it comes to acutes is I wouldn't advise mothers to give one dose and then wait. Normally, in acutes, the body is in a state where it requires repetition. So, especially with even colds, coughs, fevers, injuries, one dose of arnica 200C is not going to solve the problem. You will need to repeat it more frequently, and based on the intensity, the repetitions are equal. So that is something you can then decide based on how severe the problem is. So coming to injuries, yes, so arnica is a remedy you should keep with you. Ledum is another remedy which is very good for injuries, especially if you've had any sharp injuries. So let's say, there's a nail which has cut the skin and you can see the cut marks on the body. Ledum also works very, very well for mosquito bites. And so that is a remedy which, at least in Singapore, we have a lot of mosquitoes, a lot of problem with dengue. So because of that, ledum is a remedy that works very well. Of course, taken internally also, but you can dilute it and even locally apply it on the skin if you are going to the forest and you feel there are going to be a lot of mosquitoes around. When it comes to colds, there are different kinds of colds, and so the remedies would be very different. So maybe I'll give you 2-3 examples of that. If a child comes to me with a runny nose, watery discharge, a lot of sneezing, if I see more of sneezing, I will think of remedies like sabadilla. But if I see more of an indisposed feeling, the child has become very weak from the runny nose and the sneezing, I will think of a remedy like arsenic album. If I see a yellow discharge which is thick in the child, especially in small newborns and infants, I will think of a remedy like pulsatilla. If I see that there is a throat component involved and I see a lot of redness, inflammation, I would think of a remedy like Hiparsulf, especially if they are worse from any cold air and better by having hot drinks. So everything is, you know already, is very important with homeopathic prescriptions. With fever, what I normally see is that if there is constipation, there is increased thirst, bryonia comes up very strong. If I feel that there's a thirstlessness, then pulsatilla also can come up. With fever, what a mother should look for, which I feel like is also equally important because that is what your homeopath looks for. Look for which part of the body is more hot. Look for which part of the body is more cold. Is your child thirsty or thirstless? And especially look for the symptoms that come with the fever. So, is there a restlessness with it? Is there a lethargy? Every time the fever comes, does the cough become more? Every time the fever comes, is there a headache? Look for the timings when the fever is more. And all of those pointers will help you really reach the right medicine for prescriptions. If you see the fevers coming on more at midnight and midday, think of arsenic album as your remedy. If the face and head is hot, legs are cold, arsenic album can again come up. So these are important remedies for fever. When it comes to stomach, I would say when there's pain, think of remedies like colocynth. They come up very frequently, especially better if the patient is bending double, like so you see the child completely curled up. If there is diarrhea associated, think of remedies like podophyllum, gambogia. If there is constipation, think of remedies like nux vomica, opium if you can use in your country, bryonia. Then for a lot of kids have this growing pains, which they have. So growing pains is generally again experienced in the night. The children will wake up with pain, want the mothers to press the legs. So for that, I like to advise 2 things. One is an arnica oil. So if the mothers can just do a massage with arnica oil, it works very well. And calcarea phos in biochemic is something I give these children. If you want to know about newborn complaints and infant complaints till 1 year of age, when it comes to teething, chamomilla is a very good remedy that we use. So that is something mothers should have in their first aid box. When it comes to colic, think of remedies like lycopodium if the child is very gassy. Think of chamomilla if the pain is very intense and the child cannot bear it. There are other remedies that we use too for colic. We use diascoria sometimes for childhood colic. There is another remedy called nepentacataria which we use for childhood colic. But you have to see a few of the symptoms when you are prescribing that. Then what else can I think of right now at the top of my head? If you have any suggestions for me, please tell me because
The condition suggestion I don't have, but I have again a question came to my mind because many homeopaths in their early years explaining homeopathy with no side effect, but that is actually only true if you give the correct treatment. Because you choose the wrong remedy, there will be some penalties for that. So now that we are talking about mothers helping children, naturally they have less experience. They are not trained homeopaths. What are the risks of choosing wrong remedy for the kid? Like the intention is good, the aim is good, they have the kids, they read the book, they listen you, they listen me, but they make the wrong decision. So how they know that they give the correct remedy, and when they realize that the remedy is not correct and they shouldn't continue? Can you
Understood.
explain that part?
Okay. So, firstly, I would like to tell mothers that do not worry when something like that happens. Generally, the effects of homeopathic remedies, even when given incorrectly, are not very long lasting. So, even if in a cold you were supposed to give a pulsatilla and by mistake you gave an arsenic album, don't worry. There is nothing dramatically going to change. There is nothing which the child is going to have long term side effects of. At the worst, what will happen is the child will not improve, especially when you're giving a wrongly selected acute remedy. How will you know if the remedy is correct? Because you will see an amelioration at every front. Also, one thing to remember with mothers is that you should decide on the amelioration based on the condition. For example, if you give a child some remedy for eczema and in 24 hours the child does not improve, that does not mean the remedy is not working. That means that the condition is such that requires longer treatment. So, for a cold cough or a fever or an acute diarrhea or something, the remedy should ideally act within 24 hours. So, don't wait for too long. Don't wait for 4 days to see an amelioration with a remedy. Some amount, even a 10%, 20%, 50%, should happen within the first 24 hours. If it happens, then you know the remedy is correct, move on. If it's not working, reevaluate. So most likely, sometimes you give a lower potency and maybe the child needs a higher potency of the same remedy. So restudy the case, restudy the symptoms. Of course, the more trained you are, the better you will be at doing these things. But see that if you feel like a higher potency is what the child needs, use that. Don't change prescriptions too much because you feel not sure. Oh, it's not working. It's been 3 hours. Oh no, my child's fever is still there. Change the prescription, change the prescription. Nothing will work with the child. You have to be patient and know how much time to wait for before you know the remedy is not working. And that is a skill with experience. The more experience you have, the more you will learn when to change the remedy, when not to change, when to know what you're giving is correct. As far as side effects are concerned, I would say that a wrongly selected prescription should at the most produce the symptoms of that remedy in the child when it is a wrongly selected. So to say, the child will prove the medicine, display the effects of that remedy, but those should within a few days pass off, and it should not be any drastic pathological side effects. Not at all, not something to worry mothers about. But that being said, in an acute condition, the more experienced person prescribing, the faster will be the result. So, of course, stay in touch with your doctor. Of course, stay in touch with your homeopath and evaluate those decisions.
Again, I would like to be very precise on these matters because we are talking about the kids' health, and it's a public advice that anybody can watch and apply. So, first you said, I give 200 potency, and mostly I repeat the remedy because one single globule may not be enough, or usually not enough. But then, my concern as a parent, I mean, pretended parent, how do I differentiate that my first remedy was not enough or not correct? Like, you see my paradox here? One globule is not enough, so I have to give the second one because the first one didn't do all the job. But the first one didn't do all the job because it was not correct or because it was not enough.
Understood.
So how to solve my paradox here?
Understood. So in that case, what becomes a very big factor is experience. When I started out also being a homeopath, for me, treating acutes was something I was the most passionate about because you can see the results very quickly, so you know if you're prescribing right or wrong because that satisfaction is there. But at the same time, it's very, very difficult because especially when you're dealing with children and a mother gets a child with an acute, she's very nervous herself. You have to results quickly for the mother to for having faith in homeopathy. But at the same time, you should know exactly what you are doing. And so, like every homeopath, I have also made many mistakes, many trial and errors, a lot of wrong decisions, a lot of right decisions, which eventually gives you the experience to know exactly what you are doing. So, for example, let's take a situation of a fever, okay, because that's something we discussed a lot. When it comes to fever, if I feel like the child is improving on a few fronts, but the temperature is not coming down, let's say the child has about a 38-degree temperature. Along with that, the child has a stomach infection. So there is vomiting, there is a stomach pain. We see the child being restless, XYZ. We give a remedy to the child. The child's fever after 8 hours is still 38 degrees. But the mother says now the child has stopped vomiting. The stomach pain is a little better. The child was able to drink a little bit of water and is not vomiting the water. I think that that is a good sign for me. So you have to know what to look for. Sometimes it's not only the fever that we have to look for, sometimes it's the surrounding symptoms as well that you look for. But if that mother tells me at the same time after 8 hours that the child is still throwing up everything that the child is eating, and I have repeated the dose already 2-3 times by then I know my remedy is not the right remedy. So something needs to be changed. So this is how you learn from experience as to how much time to wait, when not to wait. It depends on the intensity also. With vomiting, I run the risk of dehydrating the child. The child will land up in emergency faster. So my remedies have to be given more frequently. I have to assess if the remedy is working or not and change frequently. Whereas with a condition like a runny nose and a sniffling and a sneezing, I know that the child is not at any risk for anything. So I can even wait 24 hours to decide if my remedy is working or not and to see a difference. Also, some remedies work very fast, some remedies work slowly. So Boric gives us an idea of that as to which remedies take how much time to work and how many hours to see the effect. So that can be a good reference point also.
Okay, thank you very much. And your description gave me or raised me a question inside me. So there are some symptoms that are more dangerous than others. Like a sniffing nose, doesn't matter if it continue a couple of days, but maybe vomiting or cough is more dangerous. So can you address this? Like, what symptoms are more important and more scary that mother okay, I'm not able to cope. Let's take the doctor, this kid to a doctor immediately. Or yeah, this can wait. Maybe we couldn't manage it well, but let me give this remedy too and wait one more day to this kind of comfort. So can you give some criteria for us, for mothers, when they should get scared and immediately take the kid to a doctor, or like, okay, this I can manage and my kid is okay or something?
Okay. So before starting on that, I would just like to broadly say that a mother is not very well equipped to understand that. So I will give a few criterias, but at the same time, working with someone who has that medical knowledge is a must, and I would definitely endorse that in every way. But if I were to give a few things which mothers have to be most careful of, is number one, look for the child's condition. If your child is playing well, doing everything, active, wanting to interact, showing some interest in activities, most likely the child is at a good level. But if that child is very apathetic, very, dull, eyes are shut, not responding, bad sign. Definitely needs some addressing. Dehydration is something which definitely needs addressing. So if you see your child is losing a lot of water through anything, it could be in the form of vomiting, it could be in the form of diarrhea, it could be in the form of excessive sweating when the child has fever. Any of that could lead the child to dehydration. Dehydration runs a lot of risks. So definitely, again, address it and take the child to your emergency for that. When it comes to fevers, a fever that has lasted more than 4 days, I would say conservatively 3 to 4 days, which has been on a relatively higher side, important to take your child to a physician. The only reason being, I'm not saying that it's dangerous, but just to get it diagnosed. You want to know whether the infection is in the throat so you can address it better. even as a homeopath, if I cannot see the patient and the patient is far away, I would not mind it if they met a local physician just to give me the examination findings. So then I know the remedy, okay, belladonna, I need to give this child because there's a redness and a sore throat and the infection is there. It helps my prescription also to know that. So fever for more than 3 to 4 days, especially high fever, definitely speak to your physician. When it comes to cough that lasts for too long should also be addressed. The only reason being that it could have gone to your child's chest and caused an infection or a patch in the lung. It could have led to asthma, and that happens more often in younger children than it does in older children. So be careful of that. Regularly, I would say if the child has a wet, dry, productive, especially an asthmatic sounding cough, definitely be in touch with your physician so you're not restricting your child's airways from breathing. So those are the things I would say would be very important, which every mother should know, and they should address that immediately. Of course, I don't need to say it, but bleeding in any way, child starts bleeding from the mouth, bleeding from the anus, all of that bad signs, definitely address that. And all in all, look for your child's overall well-being. The minute you feel like your child is not himself, even through fever, there's memory is not so good, they don't know where they are, they've reached a state of delirium, needs addressing. That could be because of dehydration, so it needs addressing.
Okay. Well, thank you very much. It
Yes.
was very insightful. I'm very sure that a lot of mothers who can speak English will benefit this broadcast. I have no more question for you at this time. If you want to add something, some closing, you can. Otherwise, I am happy.
No, I think we've covered a lot of important topics and everything that I feel like is important for a mother to start their child on the journey of homeopathy. What I would like to just close with is that at least in my 10 years of practice now, from what I have seen when I used to sit at various hospitals, clinics with my father, and even in my own practice out here, I feel like it takes a mother 2 to 3 months to understand the process of homeopathy. So give it a try, give it an experience, see how it works for you and your child. After those 2 to 3 months, you will be so devoted and so happy with the results that homeopathy can provide that you will never want to put any drugs in your child's body, and you will make all that effort to make your child healthier because you know that my child is now looking better, feeling better, is missing less days of school, is more energetic, is more full of vitality. And for a mother, I think that is the best gift that they can have, is to see a healthy and a playful child in front of their eyes every day. So I definitely feel homeopathy is something that every mother should experience at some point of time, but of course in the right hands, so they can be nurtured. My mothers in my practice, they adore the way I take care of their children because I'm always accessible, which also I feel is important. And so yes, I feel like that's enough for a mother to know, and happy to answer any questions if any mother has any on email. So you can feel free to share my email address with anyone.
Okay, it has been pleasure to meet you. We didn't talk, but you and your family actually came to Turkey. So you know Turkish people, you know Turkey. So it was nice to contact you again after a long time. I wish you well in Singapore, and hopefully we can see each other in person again in some meetings or
Yes.
somewhere.
Hopefully we meet. I think Liga is due to happen this year. So hopefully if that happens, we meet this year or next year. And in Turkey. And yes, wishing you and your family all the best. And I hope to be there soon.
Thank you. Bye-bye.
Thank you so much. Bye, Sada. See you.
Eu disse pode botar fogo, queima todo o cabaré, mas eu não vou largar tão cedo dos braços dessa mulher. Você é ciumenta e não larga do meu pé, suspeita de todo mundo, vive vida de mulher.